Hello, I'm here today with Dr. Casara Andre, the founder of Veterinary Cannabis, and we're here today to talk about dosing cannabis for your animals. And I'm really excited because there's a lot of confusion, there's a lot of concern when addressing cannabis for your pet. So I have one of the thought leaders and experts when it comes to this, someone I trust for my own animals and someone I really rely on for really good information and kind of working through these challenges and concerns that pet parents have. So as a company, we formulate products that are very unique, and we believe that not every animal is going to respond the same. So we want to address it by case, or it's very individualized. So today I hope to accomplish some things around just kind of how to start, where to start, and what to look for in a product. So thanks for being here
Absolutely.
today.
I am so excited to chat with you about cannabis.
Awesome. So when you have a pet parent come in and there's kind of no cannabis knowledge, or maybe a little bit of cannabis knowledge because we're here in Colorado, where's your starting point to say, okay, this is what I want to start you at?
Well, that's actually a great question because a lot of times people don't understand the importance of how much the pet parent knows about the background of cannabis. If you have a pet parent who comes in who sort of knows the molecules and knows the plant, it's actually way easier to jump into dosing the animal because we have some background pieces. If we say pet and pet parent are just cannabis naive, we have no idea of where we want to start, what do? We really start with a diagnosis. So what body systems are we trying to affect with the molecules we're going to be putting in the animal? What concurrent conditions are we worried about? So just as an example, if we have an older animal, maybe a little bit debilitated, maybe not enough strength in the hind end, if we start using cannabis really soon or really quickly and the animal feels amazing and they want to go frolicking in the backyard, but they don't have the muscular strength to hold themselves up, maybe we slow it down a little bit to get some strength, build some conditioning. So there's lots of pieces that go into dosing, which, like you said, makes it really tough. There's not a out-of-the-box number, mg per kg body weight. There's a lot of other pieces that have to get fit into place.
And especially on the product side, we've seen cannabis and especially CBD kind of explode over the last few years. What do you think in terms of how do we look at products, and especially for somebody who doesn't know, or somebody who does know, but they might be using the wrong product for that animal?
Yeah, that's such a great one because we have pet parents come in all the time saying it's not working, or a really common one is it worked for the first 2 weeks or so, and then I don't know what happened, it's just not working anymore. And so while there's still a lot of things that can go into that, the condition could have progressed, something could have changed the animal's life, most of the time we find that it means that the molecular profile in the product just wasn't the right fit for the animal. So one of the reasons products like Earth Buddies are really lovely to start with is because they have a really broad molecular profile just to begin. So we have a lot of CBD, a little bit of THC, a lot of the minor cannabinoids, but particularly a terpene profile. It means that when we start an animal on that type of product, we really get to cover our bases and kind of see how the animal's going to respond.
So when you look at, our product we're very proud of, and we have this big spectrum of different molecules and compounds in it. Let's say you do have a pet parent that comes in and says, hey, this product stopped working. It was working really good. How do you address that when maybe you know the product is quality, and take ours out of it, and you don't know how to, or you do know how, but what do you do in that scenario when it does stop working? In terms of work, we got to address that maybe.
What does work mean?
Yeah.
What does that actually do?
Yeah, exactly.
Well, that's probably a good time to go into what does work mean.
Exactly.
Many, especially right now, many pet parents are using cannabis products for anxiety or behavior-based conditions, any of those things. So probably the first questions I would ask is what changed the animal's environment? If you're using a cannabis product to help separation anxiety, say you were using it prior to all the COVID incident and all the segregation and separation and people staying at home, we are seeing a lot of those products not work anymore, not because that it's not what the animal needed, but the environment has changed. And we need to change how we're dosing, when we're dosing, what the pet parents are doing at time of dosing, and some of just the environmental stuff that has to change. if a pet parent comes, say we're using it for a pain case and it's not working anymore, that would probably be a case where we would try to change the molecular profile. We might want to add in some more THC. So then we get to the place where we can do Franken products is what we've ended up calling them, of mixing a couple of products together.
So set and setting is just as important for animals
Absolutely,
as it is
which
people.
we don't really think about that
Right.
very much or talk about it very much.
Can you explain kind of the understanding of set and setting?
Yeah, so I actually don't like that phrase as
Okay,
much
yeah.
because it doesn't give a good description.
Right.
Not because I just like the phrase,
Yeah.
but it doesn't tell you enough there.
Right.
So set and setting, that came from mindset and setting for the human
Yes.
side. So what are you surrounding yourself with before you take cannabis, and what is the actual environment? And we find that it's actually equally important in animals. Let's do just a case example. If you have an older animal who maybe we have some arthritis showing, maybe some anxiety, but we also have a new puppy in the house and we're trying to handle all these issues. If I give that older animal a cannabis product and yet the puppy's still there and tugging on ears and wanting to play, that older animal doesn't really have a chance to relax into what these molecules can do. It has to stay on. Do you know what I mean by that? It has to stay up and aware of what the puppy's doing. So we might make sure the older animal has a little bit of quiet time, a little bit of downtime when we give the product, or at least making sure they have the opportunity to relax. So things like that can be really important in the animal world as well.
Yes, and do you see that even with the pet parents' anxiety
Yes.
levels too?
So much so.
With sometimes the product could be great, there's nothing wrong with that, the dosage was right, but the pet parent might have some stress and anxiety about
Yes.
administering, or even just their concern about using a cannabis product.
Or I would even add to that their own emotional state. Again, particularly in this time of the world, we see some really interesting intersections between the emotional health of the main caregiver, usually, but also the emotional health of the household and how that affects the emotional health of the animal. And we know that emotional health and physical health are very closely intertwined. So especially in, say, some seizure cases is where we see this quite often, when usually when the primary caregiver has some significant anxiety condition themselves, anything along those lines, migraines is really common, we will see that have implications in how we need to dose the animal or how that dose is working. And often if we can get that owner to be a little bit more calm, a little bit more settled, do some mindful meditation, go for a walk, take the animal with them,
Yes.
usually it's better across the board. Now I don't work on the human side, but very often we will send them to one of our friends who does work on the human side and say, we'll take care of the animal piece, but you know, you're a mammal as well. You should use some cannabis for yourself as well.
So we mentioned kind of some basic anxiety, arthritis, stiff joints, even seizures. What have you seen things around cancer? Because I think one of the challenges as a company, we think the worst case scenario. We made this product for your worst case scenario, and then all those kind of baseline things we can address really easily in lower doses a lot of times. What do you see with things like cancer or some more severe neurological issues? Because that's harder to say, like, hey, we gave them this product and it's not fixing the cancer, or you know, and our goal is more of quality of life and comfort. So I'm curious to know how you address that with pet parents and the expectations, I think, is what I'm asking.
That expectation setting is just has to be foundation for any of the consults that we do. If a pet parent comes in really wanting to have a definitive cancer care, so meaning we are trying to kill the cancer cell.
Yes.
So there's definitive care and palliative care in oncology. If we're going the definitive route, many times we have to do these Franken products and mix them together because we have a particular cell type that we're trying to change. And we actually have some really good research studies saying more of this particular molecule, this terpene might be beneficial. So we can actually try a definitive approach. However, most pet parents are looking for palliative care. Sometimes both, but when we're going down the palliative care direction, it's really lovely to start a CBD dominant product because we're trying to support the entire body system versus targeting this one specific cell type. Now, it doesn't mean you can't do them both together, but whenever we're trying to do the palliative care side, a really broad base of molecules is the best place to start. And those are often ones that we have them at quite high dosages. we don't always know where we're going to end up. So talking more specifically about where you start, where, amount you're trying to get to, that start low, go slow works just like for animals as it does for people. Starting at a dose that is ideally for us, you're not going to see any effect. Like lower, no one's going to notice, and then working your way up over time. In some of these cancer cases, we often have them at quite high doses when they start to tell us they're feeling better. So we see their appetite improve, their attitude improve. Pet parents usually say they're sleeping better, they're just more interactive, they have a light in their eyes again. And it often is hard to know what our end dose is or our target dose is because it is that well-being. Like, how do you quantify that? So the pet parent keeping a journal, videos, pictures, those are really useful for us to track over time how an animal progresses and say, yeah, he's doing significantly better at this dose than he was a month ago or 6 months ago. So the palliative care side is tough, but it's a really fun area to work in because you see these animals just light up again and be willing to interact and go for walks and sleep better.
They get their best friend
absolutely
kind of back. Yeah.
I hear that phrase so often. You hear it on the human side as well, but in animal medicine, it's they gave me my best friend back. They gave me, my animal back. I've missed this animal for a couple of months, and if there's anything that's more heartwarming than that, I don't know what it is.
It's totally worth it. You were talking about high dosages, especially in regards to these more severe issues. Do you ever see circumstances where even in those situations we might not need as big of a dose? The dose, and you mentioned journaling and kind of the optimal dose. Do you ever have situations where maybe they were using too much and we had to bring them back down and they actually did better in these lower doses?
Absolutely.
And it was a severe situation.
I'll give you a couple of examples that I think draw that out pretty well. Many times we'll have a pet parent come in using maybe a CBD isolate. Now, there are definitely uses for a CBD isolate. There's nothing wrong with them, but especially if we're talking about a more severe case, cancer, a seizure, something like that, we really need that mix of molecules to support multiple body systems. So many times if a pet parent's using a CBD isolate, they're way high on their dose, in the hundreds of milligrams. Research shows us that we don't really get as much effect when we're just using one molecule at higher doses. More is not necessarily better. We're finding that when we add in more molecules, so using a product that has a more broad base of molecules, we can come way, way down from that dose, and that a smaller dose is usually getting us where we need. One of the things that's been interesting is that we're exploring and kind of trying to chart over time at these really high dosages, maybe when the body doesn't need all those extra molecules, we need a different array of molecules. Is that when we see elevation in liver enzyme? Is that when we see some of the side effects? And we're not entirely sure, but my gut tells me yes, that at some point we're just giving too much and the body has to work on getting rid of it. So often when we lower the dosage but add in more molecules, we have a better clinical outcome.
We talked about expectations and how important that is. How important is it to journal when entering, even if you're using, like, let's say our hemp hearts, which are really low dose, 4 and 8 milligrams of CBD. How important it is just to even start with that, so you give not only your pet a chance to have a better option, but also the expectation.
Yeah, so important. If there's one thing that a pet parent can do that makes my job easier in helping guide a case, it's to keep a journal. And it's so easy, written, scribbled on a piece of paper, kept on a phone, kept on a spreadsheet, doesn't really matter. But for me to be able to see trends over time, mean that I can look at that and say, oh, we sort of peaked at benefit here, now we're not seeing any better, let's change something, let's make a difference. And so even in a low dosed treat form or capsule form, any of those, we still see animals respond amazingly well. So just because it's a low amount doesn't mean that it's subclinical or subtherapeutic. We should still be journaling those so that we know what's happening, and then we can adjust the dosages over time.
So we mentioned a couple different preparations. How much difference in response and things like that do you see in different preparations? Is it good to vary those preparations as well?
So the formulations, you mean, like the treat form versus the tincture form? Well, you know that I like the tincture form best, just because that's my preference. But that usually is because I'm trying to get the animal up to higher dosages. I still like the lower forms, the lower dose forms. It's just, it's easier to work with. If we are using a tincture form, that's probably going to be in the more serious cases. So I need more milligrams without adding volume. Does that make sense?
Yes.
But if I have maybe a pet parent who is, both the animal and the pet parent are naive to cannabis, starting with a treat is probably the easiest way to go. So often the treats are our entry-level formulations to get everybody comfortable, start the journal, see how the pet's going to respond to it, and then usually we move them over to a tincture because then I can do more work with it. However, I love the options that capsules or powders give us, especially for picky animals, picky cats. So you really do have to have a mix of formulations because it is about the animal's preference. If you're fighting with them every time you dose them, it's not necessarily getting the best benefit. If you can give it stress-free, that's better across the board.
Yeah. So you mentioned the word cannabis naive, and I think that's really important. But there's also the people who are cannabis users and people who are, at least in Colorado and other recreational legal states, that are familiar with cannabis, know a little bit about it, but when it comes to using it on their animal, they're like, heck no, that I don't want to get my animal high, whether it's a CBD product or not.
Yeah.
They're just very wary of giving it to their animal. And a lot of times I feel for them because, yeah, it is kind of scary. You're giving a product that you've been using to intoxicate yourself or something. How do you address that, whether they know a lot or not, or maybe they work in the marijuana field and they're still weary of it?
Isn't that interesting how it just, the perceptions and the expectations you think would be there don't necessarily cross the board. It's just, we definitely find lots of different mindsets as we deal with pet parents. Let me address actually a couple of other ones first. So the easier sort of ones to tick off. We have the very, I'm going to give cannabis to my animal because I'm a user and I know exactly what I'm doing. Those can be dangerous because there are ways to negatively use cannabis or to a naive animal that we don't want to give them such a high dose. So sometimes in recreation states like Colorado, we see people be a little bit too cavalier because they feel comfortable themselves. So there is a difference between humans and our veterinary species. Lots of similarities, but there are some differences that are important.
They think the dog has their tolerance.
Right, exactly. And they're going to start with exactly what they've been doing. And the dog's like, I'm not quite there yet. However, what you're mentioning of pet parents who are cannabis users themselves, but are still really leery of using a cannabis product for their animal, that's probably the majority. I would say that a lot of that comes from really awful fake marketing from many cannabis companies trying to push the negativity of THC in animals, and we know that that's just not true. All the safety studies we have on cannabis in animals have some THC included, so we know that it is safe, and clinically we see it be very therapeutic. If we are in a situation where the pet parent's just like, I'm not sure this is okay, can you give me some guidance? As long as we do that start low, go slow, and the pet parent's journaling, it gives us time to identify any negative scenario that's going to come up. So even for pet parents who are nervous starting a cannabis product, start as low as you possibly can, keep a really good journal, and you're going to see maybe some sedation, maybe really that would be the worst thing you would see in that scenario, but you're going to identify it before it's actually a problem. So that is my best recommendation for people who are a little bit leery. You can start it. It is most likely going to be positive for your pet. Just keep a journal and you're going to be on the right road.
So you mentioned, pet parents coming to you with a product. Sometimes it's hard to know every product. There's so many out there.
Very much so.
When a product comes and falls in your lap from a pet parent and they're like, I don't know anything, but I got this product. Somebody said it fixed all these things for their dog or had all this, benefits. What is your first steps in analyzing a product as a veterinarian that sees all these different products probably on a daily basis? What are your first steps in helping that pet parent understand what to look for in a product? Because it might be a great product, it might not be the best product.
So if I don't know the product, we kind of start from ground zero. For me, I use one of my technicians, one of my veterinary cannabis counselors to do this research, but we always start with the COA. If we don't have easy access to a COA, it's probably the best marker of a company's integrity and did they know what's going on? Do they know the importance of testing if it's on their website or easily accessible? So if I send an email, can I see your COA? And it comes back in a couple of hours or a day or so. That company already gets a check mark in my book because they understand what I'm looking for. They're making it easy for me to make a clinical assessment and a clinical judgment. On the COA, we know those can be across the board. There can be so many differences on a COA, but I for sure want to see cannabinoid profile. I love when I can see a terpene profile because that gives me a lot of information, but I for sure want to see the safety information. So the freedom from heavy metals, pesticides, all of those pieces. If I don't have at least the cannabinoid profile and the safety information, I'm also really not going to be looking at the product. If I don't have the terpene piece, I'm okay with that, but it still is a big important piece of my clinical information is missing. So that would be my ideal, a really good, solid, complete COA that's linked to the batch number or the lot number so that I really know that this COA matches the product that I'm looking for. So that one, hands down, is my number one.
So not every pet parent is going to be able to analyze a COA, and you're only one person. You can't handle every pet parent jumping into using a cannabis product. What are some good ways that a pet parent can at least know the product is safe? Maybe they don't have to be COA experts. And can you explain what a COA is?
Yes.
So
kind of jump
people
into
that
jargon there.
If you can explain what a COA is, and then kind of some things they can do on their own, or at least work with a veterinary professional. I think that's important to have more resources because sometimes, again, you're only one person, we're only one company, and we can't address every, the 70 million pets that we have here.
Yeah. Well, so to sort of break those down to the ones you asked about, a COA is a certificate of analysis. So it's the lab test that comes with a particular product. If you're a pet parent and you don't have someone helping you through the analysis of a COA and you want to look at it yourself, making sure that you have demonstration of no heavy metals, no pesticides, that they've done some lab testing in that area, that's number one. You may not feel comfortable analyzing the cannabinoid profile, so which molecules are in there. You probably need a veterinary professional to kind of help you through that, but at least you can say it is an isolate, so it has just one molecule, or look, there's a decent mix of other molecules, and that can be a good place to start. Remember we said in the beginning, if we're working on some of these complicated cases, really just having a broad base of molecules is the best place that we can start. So if a pet parent looks for those things and keeps a really good journal, when they bring on a veterinarian or take that information to a vet, the vet's going to have so much more to work with, just with those basic pieces.
So at least have a company that's forthcoming with these COAs.
Have a COA available and willing to share.
And starting them on even a rough journal. And then if they don't have just a forthcoming COA with those safety measures, that would probably be check one and kind of running for the hills. So that's really important. I think, what are some other ways we can kind of friendly up cannabis to pet parents? Because with our products at Earth Buddy, we feel that every pet as they age can benefit and can become, cannabinoid or endocannabinoid deficient almost. They're going to experience a lot of the same things we do, but much faster because of their aging process. What are some other ways we can kind of explain to pet parents, like, hey, this is something that as your pet age can benefit just from a lifestyle standpoint, maybe just they're getting older?
In humans, we have a very defined condition called clinical endocannabinoid deficiency syndrome. So for your pet parents who aren't familiar with that, essentially it's a deficiency of the endocannabinoids that we make as mammals. And in humans, it's been very closely linked to conditions like IBD, migraines, anxiety disorders, Crohn's disease, a lot of the conditions that we just have a hard time dealing with in Western-based medicine. We don't know for sure that same condition exists in animals, but I absolutely am convinced that it's there. We just haven't looked into it yet. So what you're saying about as animals just age, and after they pass sort of their prime of life and that older animal, maybe the senior animal lifestyle, it is probably a good idea to make sure we're supporting their endocannabinoid system. And we do that best by having, yes, a mix of molecules, but the CBD dominant products are really, really good at supporting the endocannabinoid system of that animal. So I think probably the best way to get people just more knowledgeable about cannabis in general is to talk about what is it doing within that system. What is the endocannabinoid system? Why is it essential to life, learning, well-being, and what are the principles that we know about why it gets depleted over time, why stressful situations can deplete it, things like that, because then it makes more sense why we might need to use cannabis to supplement as the animal ages.
We're using the term endocannabinoid. Can you explain to us what an endocannabinoid is versus what a
my favorite
plant-based
topic
cannabinoid is? Because I think that will kind of preface what we just talked about in terms of the deficiency that our bodies can have, and same with our pets.
Yes, absolutely. So the root of this question is understanding what's going on inside the mammal. So all mammals have a set of receptors that are part of an endocannabinoid system. So cannabis is hard because there's so many cannas and cannabinoids, and so it's kind of hard to keep track of all of those. But essentially, if you think about it as we all mammals have receptors that our body uses to regulate between systems, our nervous system, our immune system. Inside of us, we make cannabinoids, which are a molecule that bind to these receptors, and because we make them ourselves, we call them endocannabinoids. Inside is the Latin root of that. If the plant is making the molecule that can bind to those receptors, then we call it a phytocannabinoid. The plant made it on its own. What's lovely is that both these molecules, endocannabinoids and phytocannabinoids, still bind to the same receptors in our body, so we can help and benefit this system inside of ourselves from either side, either from supporting what's inside or helping from the outside. So whenever we're thinking about using a cannabis product for an animal, essentially what we're saying is we need to stimulate these receptors that are already inside, but we're going to help from the outside in. You asked a question previously that we didn't quite get to of maybe we lower the dosage over time, or maybe we need less as the animal progresses, and we absolutely see that. As an animal's own system kind of kicks into gear and says, oh, I'm supposed to be making these, I can do it myself. We often need less cannabis because now the endocannabinoids are being created at a good speed, the right rate, being used appropriately. So cannabis is such an individualized medicine, and it changes day to day.
And we see that in certain research where they're showing some cannabinoids kind of stimulating that natural production,
Yes.
which is really exciting because I think to your point, it's so individualized and there's so much we don't know that there's a lot in the way of different formulations and different preparations that we're excited about. I think we were talking about addressing the endocannabinoid system. It's really cool because it's almost like Mother Nature created a plant that completely coincides what we're doing naturally, and we can engage that system. So I think that's great.
In the human side, we have lots of evidence of how we have evolved with this plant, and our animals have evolved with us. So the same thing. It's interesting, though, to think about the plant doesn't really make these molecules for us, but we as mammals have grown and evolved in such a way that we can utilize a plant and molecules a plant makes really easily. So when you think about it, just in terms of a bigger ecosystem, a bigger existence, healthy planet as a whole, we really see cannabis give some benefit to the human mammals, the veterinary species mammals, and then just how we all interact and coincide. It really creates a beautiful, beautiful interaction.
The biggest question we get at Earth Buddy is how long before this product works?
Great question.
Hopefully they've given us the opportunity to ask them, what do you need it for? Sometimes we have people just try our products and we have a lot of different preparations. We add other things in it. A lot of times we're not there to kind of educate them on what product would be best for their animal. What questions do you like to ask the pet parent prior to addressing a certain product? And then in terms of how long before it works, what do you kind of set them up for?
What's my time frame?
Yeah, exactly.
Expectations
when is it going to
again,
work?
Right?
Yeah, exactly.
When is it going to fix it?
Yes.
So that brings up such important points about expectations of what are we trying to fix? So if we just do cancer again, are we trying to definitively treat a condition, so kill cancer cells, or are we trying to go the palliative care route or a mix of both? And so that in itself gives us a different set of expectations. If we're using a product that is pretty much CBD dominant, so that's the largest molecule base that's in there, I always tell pet parents to expect a week and a half to 2 weeks before you're going to see the kind of the peak benefit. You can definitely see benefit earlier than that, but if you're not seeing something, just to kind of wait it out. The reason for that is those CBD dominant products are so good at supporting the internal systems. So they're kind of just keeping the resources that are already there more available. Now, if you have a product that has a more balanced formula of between CBD and THC, then we see those products work a little bit sooner because we have the THC molecule in there that is stronger. It's kind of our harder hitting one. And so we can see, depending on how much THC is present, effects over a couple of days, 2 to 3 days. So then it gets a little bit more tricky. But if we're just gonna stick in the realm of a CBD dominant product, a week and a half to 2 weeks to really know how much benefit the animal is gonna receive. Then you can tweak it, you can change your dose, change your product, any of those things later, but at least wait for that long to see what's gonna happen.
So we hear this a lot where, hey, my friend gave this XYZ product to their animal who's crazy and it totally chilled them out. Then they go to the product themselves, that same product or another company, and it doesn't quite work for their pet the same way. How do we kind of bridge that gap to say, hey, it's not all the same?
That's a great question, and one that I didn't quite address previously. I was more talking in a chronic condition where we have lots of body systems involved, cancer, pain, seizures, things like that. If we're working on the anxiety side, we tend to see a little bit of a different set of effects. We can see changes within a couple of minutes, 10 to 15 minutes of it being administered. It's also not going to necessarily last as long. So it really goes back to the condition we're trying to treat, what molecules are in there. But if we are using a CBD dominant product for an anxiety scenario, you can see changes or benefits pretty quickly, 20, 40 minutes, something like that. And then making sure you're also putting the behavior modification in at the same time. That's important. It's not just a pop a pill and hope you're fine. It's use cannabis and then shape that mentality, shape that neurology at the same time.
You said behavior modification, so you'd mean like training or maybe even having a regular routine with that dog would help the process instead of just like saying, hey, go lay down.
Yeah, I mean, if you think about it, if you are using cannabis for, let's just say, mailman anxiety, that mailman always comes and if I bark loud enough, he goes away. Yeah. Shocker. So when we're trying to use cannabis to change some of those anxiety-based conditions, if we hand some cannabis to our animal and then I leave for the day, bye, I'm gonna be off at work. The mailman still comes, the neighbor dog is still scary. So things in that environment haven't changed. We may actually be making that condition worse because we are allowing some neural pathways, some behaviors to become embedded. But think about this, if we use cannabis in a scenario, we're finding that about an hour to an hour and a half is a peak, really ideal time to then do some training. We have the nervous system in this really ready to receive new information state. Then we do some training, crate training, have someone come knock on the door. We really have the animal in a place and time, a set and setting where they are able to receive new information. And then they are able to implement that new information next time the mailman comes. So it really is important to think about all those aspects, environment, mindset, the pet parent's mindset, because it does play into this. We see on the human side, work with cannabis in PTSD scenarios, the timing of it is actually really important. Making sure that you are in a safe scenario, in a safe setting, using the cannabis molecules to sort of change behavior, but then you're doing the behavior modification at the same time.
Yeah. So I want to jump around a little bit more because that's just where my brain goes because you brought up so many good topics. You mentioned THC for pets. That is a big one that people are scared of. And a lot of companies that we see in the market are now saying THC-free as if it's a better product for the animal. You mentioned using THC with pets. Why are companies removing that and saying marketing as if it's better or safer? And why would we want it in the product more consistently?
So I will use a THC product if I need to. And that's usually a case of the pet parent has brought me one and said, I really want to use this one. Like I'm really stuck to this product. I really believe in it. That's fine. We can absolutely work with that. The CBD molecule, which is going to be dominant in that product, is really good for being supportive, regulatory, kind of body-wide, but it's also a little bit non-specific. So once we get into the more serious cases, so serious pain, serious inflammation, definitely any of the cancers, really any of the seizure-based conditions, we need a couple of other molecules to round out what we're trying to do. The THC molecule in particular binds to neurons. So if we have anything that is neurologically based, we need some of those molecules to really make a significant impact. That marketing piece of THC is dangerous is such a pet peeve of mine, so I won't get on that soapbox, but it really has been a marketing ploy of ours is better because we have no THC in it, but from a medical standpoint, that's not true. That's not been proven. In fact, the opposite has been very thoroughly proven of a mix of molecules, including THC, often makes for a much better clinical outcome. Now, if you have a product that has lots of THC, so like a recreational human use product, then we absolutely can end up in an intoxication ER emergency scenario. But what we're talking about are clinical therapeutic uses, which is often quite low, mixed with a good amount of CBD. We don't see those problems in animals when we use it in a therapeutic context.
So it's almost like we need a team of
absolutely
of people or molecules in this sense, and that's why we have the entourage effect.
And that's and it's nothing new to medicine.
Right.
When we're doing anesthesia, using a mix of molecules makes for a better clinical outcome. Means that animal is safer, goes through that anesthetic episode easier. When we're using pain control, we try to avoid one molecule only and use a mix of molecules. So this is nothing new to us. It's just the marketing hype kind of got away from it before the scientific community said, hold on, wait a second, that's not really true. But now that we have some good research and backing, we can absolutely say, yes, we do need a mix of molecules.
And we look at it as a minimal effective dose. I think that's our goal, is we don't want you to have to use a ton of our product for it to work. So I think it's right in line with that. You mentioned PTSD, and I have thoughts on that with rescue animals. I think a lot of rescue animals have been transitioned from a homing situation. They could be fosters, they could be back in the actual rescue or the Humane Society. How does that play into pets, cats and dogs? Because we've kind of talked about dogs, and they always get the fair share.
Cats.
Yeah, cats and dogs, and a lot of cats are in adoption facilities. Do you think animals experience kind of that traumatic stress, especially from a rescue situation?
Absolutely. So let's just do a couple of topics that are in there without forgetting about cats, because you're right, they always get kind of
Poor
the short
kitties.
straw. But cats are such emotional radars for the human household. Oftentimes a pet parent will come and say, my cat is just being horrendous. And when we think about the environment, it's often a very stressful environment. That pet parent is very stressed. So unfortunately, kitties are often just reflecting to us what they're feeling from us. So there's lots of things that can be done in that scenario, but very, very important on the cat side. As well as many cats are rehomed, surrendered, returned to a shelter for behavior conditions, for anxiety-based conditions. A lot of medical conditions in cats are very anxiety, stress-related. Any of their urinary issues, a lot of their kidney stuff, a lot of their GI stuff seems to be very stress-related. So when we're thinking about using cannabis simply as an anxiety reliever, as a regulator, many times we see some of those very hard to deal with kitty issues be resolved. Then to kind of the bigger issue of PTSD. So there is a true canine PTSD that has been quantified for military working dogs. Oftentimes this is truly defined as been in a war zone, been deployed. However, we also see a lot of emotional trauma from what you're mentioning, being in shelters, being abused, being in a traumatic situation, separation anxiety, any of those things. And so while we don't know this yet on the animal side, it's one of my definitely passions. Can we take what we're learning from the human side of PTSD and work with cannabis and apply it to some of the emotional trauma that we see our animals experience? And do we see benefit, and do I think it works? Yes, and I think we can draw some very close parallels. Do we have the research studies to back that up? Not yet, but it's going to be a hard one to tackle because there's so many things that go into behavior that's actually really hard to research, because you can't change just one factor at a time. You're changing so many environmental pieces. It's kind of hard to keep that quantifiable, really objective. But do we see it make a difference? Absolutely, absolutely.
Yeah, the good thing is we're seeing a lot of animals, service animals, helping our vets with with PTSD. So at least there's some research starting to come out on that it is significantly helping them. My dad being one of them. So that's really awesome for me. One more thing on cats, because I want to give them their fair shake. Cats are really hard to dose cannabis products. What are some tips that we can give to cat owners? Because that alone can cause some stress for the cat owner. What are some just basic tips that we can use? Because we have some really unique products, but they're plant extracts. Cats are carnivores. How do we get cannabis in a cat's body without causing more anxiety than we're trying to address?
So usually it's the getting it in animal.
Right. Yeah,
right?
exactly.
The cats are like, no, I'm not having any part of this. I don't like it. In reality, we think it's mostly the smell and taste of the terpenes.
Right.
However, clinically, we see the use of terpenes or the inclusion of terpenes make a huge difference therapeutically. I will be absolutely honest and say sometimes we just make a choice and say, what is less stressful? We want to at least get something into this kitty. So maybe we don't get the best option, but we get an option, or at least some of those molecules. So oftentimes we do go with that. However, as companies like yours make more options on the formulation side, some of the capsules that you can open and sprinkle over a really heavy oil base, a really smelly oil can often be all that you need. And the cat's like, yeah, that's all I needed, I'm good. And if you can find an oil base in the food that matches the oil base of the product, you can often mix it pretty well. So like a tuna, fish, or an oil, something that's going to hide or mask the flavor, can often get a terpene into a cat. Right. Sometimes they're just not going to have it. Some kitties are fine taking a pill, and so owners can buy the little empty gel capsules and make their own with putting some tincture in there, then down the hatch. So unfortunately, that's not an across the board. You really have to play that little kitty's preferences. So pet parents, be patient. Keep a journal so you know what worked and what didn't. And don't be afraid to experiment with the foods that you're using. Cats have very strong preferences, and we just have to work with that. Yeah,
and some might not like the meatiest product ever, and some might. So yeah, it is really important to know to mix it up. We kind of touched on it in talking about that. How important do you think diet and lifestyle play into how cannabis products work?
Absolutely. Absolutely essential in trying to make any change, and often you can make the change that comes from cannabis more effective, broader, by changing, again, that set and setting, all the other things that are coming into that animal's lifestyle. So we talked about the emotional piece quite strongly. Diet absolutely supports the endocannabinoid system. It supports how we interact with the world. There's lots of good information about serotonin made in mammals' guts. So healthy gut, healthy GI absolutely changes our neurotransmitters. So that's a piece in and of itself. Then when we think about just when we're administering, lack of stress, happy environment, I think it absolutely makes a difference. I think it has to be a holistic, integrative picture no matter what type of medicine we're doing.
Awesome. I think we covered a lot. I think one more thing I wanted to ask you is there's so much on the horizon in terms of research and things we can address. What are you most excited about as a practicing veterinarian in cannabis and treating cats and dogs?
The ability to customize.
Yeah.
The ability to have exactly the molecules that have been shown to be effective in the case that I'm working on. Does it mean that I can't work with just a base product and make it good for the animal? Yes, I can. But as a practitioner, the ability to cut and paste and mix and really tailor something to that specific case, that's my ideal. That's always the one that I'm going for.
So being more fluid with your dosing plan and that specific animal, I think that's a great way to round it out. Is these products are very individualized, and having that fluidity is important. Journaling, feeding the right food, and having the right place and time to administer it.
Absolutely.
So, thanks for doing this with us.
Absolutely.
I really appreciate it.
Always fun to chat
awesome.
about cannabis, and always with you.
Thanks.
You're welcome.